Good afternoon. Please, we cannot hear the audio. It's muted.
Affirmative. There's no audio. Hello, please, there's no audio.
And of course, my very beautiful and handsome students. Great Ife, articulate Ife, ever conscious Ife. You are blessed. Of course, the guest lecturer today is a brother, a friend, a reliable ally, an intellectual. If we started here in those days together, and if he had remained in Ife, I know his professorship will be around 13 years old now. He may look young in the face, but he's an old man. Dr. Shola Adeyemi, thank you, and thank you. Please, I would like you to rise up and give him a big ovation. Thank you. Please have your seat. He has done so very well, projecting the image of this university. He started as a researcher. I remember back in those days when we used to, read work like Jackal. As graduate assistant, you have to teach tutorials for like 8 to 9 hours in a day. You have to do your research, and all those things. And with all those distractions, what boys do when men were boys, still do some other things and then play football, all of those things. But we were excelling in whatever assignment that we were given. So I'm sure he will share part of that story with you to motivate you, how you can move from grass to grace. We thank God for those that he used for us in those days, the likes of Professor Afuakwe, late Professor Afuakwe, late Professor Imoru, late Professor Fagbung, and then many of them. We thank God for their lives. So today, Dr. Adeyemi will be speaking on a research journey through statistics, data science, artificial intelligence to human-centered healthcare innovation. I know he has used his statistical innovation to solve some of the problems confronting humanity in Europe, in America, and then, of course, in Africa, specifically Nigeria. I remember there was a day I was in, was it Washington? And it just, and he too was there, and Prof, I'm also in US. He hooked up, a very nice fellow. I also remember the other time I was in Frankfurt. He and his wife, they came all the way from Bonn to fetch me at the airport, and they gave me a good treat. Even the shoes that I'm wearing today. That's the other side of him. Very kind, and a lot of our people that go abroad can testify to his great hospitality. So if you find yourself in United Kingdom, just call on him. You can pay your ticket, pay everything. He's rich. So, and I want you to pay attention to what he's going to talk on. I'm sure that it will open your eyes to see your discipline in another way. You see, the essence of university education is not about the course that you read or even about the class of degree that you ended up with. It's about you coming in like you are here with an empty box And how you survive out there depends on how heavy your tools in those boxes are when you graduate. If you wish, like I used to tell my students, if you wish to work in any particular company as an undergraduate, and you don't know where to work after your youth service, when you are in part 2, you will struggle to get jobs when you graduate. Some of us made those mistakes when we were like you, and I don't want you to make that mistake. There is nowhere you want to be that you cannot get to. Be focused. There are a lot of distractions now. Be hardworking, and God will be with you. Let me also recognize first the occupier, the first occupier of the Pastor E.A. Adeboye Professorial Chair in Mathematics, Professor Layeni. You are welcome, sir. And of course, our father in the faculty, you know, he has done so much for this university, the faculty, and the Department of Mathematics. Respected Professor A.P. Akinola. You are welcome, sir. So we usually organize faculty lectures, bringing people whose area of research have impacted, you know, so many, and also those who are in the industry to come and talk to us so that we can have a kind of handshake between the academia and those who are in industry. What is the essence of our knowledge if we cannot turn it into something that will impact the society? So these are some of the things that we missed, but we do not want you to miss. So in doing so, you will engage with them. You know, they impact you. They help to straighten your path. And also, they also meet with our researchers, and then, you know, they can work together for the betterment of humanity. So I implore you to pay attention to the lecture. Please, there is what we call appointments and promotion committee meeting going on. So I left there. When you do not see me on the high table, know that I've gone back, but I will be coming in and going out. So I want to thank you so very much for coming for this faculty seminar. Thank you. Yeah. Okay. Before I go, let me intimate you that on 11th May, yeah, we have a distinguished professor, a former Vice Chancellor of University of Ibadan, Professor Idowu Olayinka. Okay, on the 12th, Professor Idowu Olayinka that will be coming to give a lecture during our international conference organized by Faculty of Science. And then on the 28th of May, again this year, we'll be having a well-recognized professor in the world from University of California at Irvine that will be coming, is an expert in public health that will be coming to speak to us on our faculty lecture. Please do not miss all those things, all these events. When you meet great people, you can be sure that you'll be greater than them. Thank you very much.
Thank you, my Dean. That was an opening remark from the Dean of the faculty. We have a chairman of the occasion, who is Professor Mrs. Durosibi, who will welcome us officially on this program. You're welcome.
Thank you very much. A very good morning to you all. Let me stand on the existing protocol as laid by our amiable Dean, Professor Additional, who also happens to be my dear Aburo on the seat. having done that, I must recognize and appreciate the presence of Dr. Shola Adeyemi and his amiable wife, Antonia. You're welcome. By the way, Dr. Adeyemi is a great Ife. It's an alumnus of Ife. Great Ife. Great Ife. Dr. Adeyemi, I can't hear you. Great Ife. Thank you very much. We're very delighted to have you. And I'm very sure you are going to find the lecture very interesting. Very interesting in the way that there's nothing that you can do without statistics. There's nothing you can do without algorithm. There's nothing you can do, whether you are a zoologist or in the Department of Botany, you need to process data. And I'm very sure you are going to find this lecture very fascinating, very interesting. And I want to implore all of us to please be very quiet so that we can benefit maximally from this lecture. I want to thank the faculty seminar organizer for the periodic seminar that we have. And I hope you all have a good day. Thank you very much.
Yes, the next thing on the agenda is supposed to be the citation. But before then, I want to call to the high table professor from mathematics, Professor A.P. Akiola. Please, Prof. Professor A.P. Akiola, sir. Please keep clapping until Prof comes to the high table. Keep clapping. You're welcome, sir. You're welcome, sir. You're welcome, sir. All right. Now, to read the citation of Dr. Shola Adeyemi, is the head of Department of Statistics, Professor Olosun Day. You're welcome, Prof.
Yeah, let me start. Let me start on the existing protocol. Please, Dr. Shola Adeyemi, stand up and step forward for citation to be read. Well, you have a long list of achievements, but I will just summarize it. So I'll just summarize. Dr. Shola Adeyemi is a distinguished mathematician, statistician, and operation researcher. Whose career spans academia, industry, and global healthcare innovation with expertise in biostatistics, epidemiology, machine learning, and healthcare modeling. Dr. Adeyemi has combined rigorous academic research with real-world solutions in the pharmaceutical, biotechnology, and public health sectors.
I killed him, Matt. Do you have...
He began his tertiary academic journey at the University of Ibadan, where he bagged his BSc in statistics, and proceeded to our great university, Obafemi Awolowo University, for his MSc in mathematics. He later pursued advanced research in Catholic University Leuven in Belgium and earned his PhD in applied statistics and information system from University of Westminster in United Kingdom. His doctoral work on patient flow modeling earned him the UK Operational Research Society PhD Prize
runner-up in 2009. Dr. Adeyemi has over 50 publications, including articles in top journals, referee conference proceedings, and an invited contribution to a book on intelligent patient management. His research cut across both methods and application of statistical science. Throughout his distinguished career, starting from with a 7 years academic career at the Obafemi Law University, Dr. Adeyemi has also amassed over 16 years profound industrial experience in pharmaceutical, biotechnology, and research and development sector. His managerial and leadership roles have included positions such as biomedical statistician, manager market access analytic at Johnson & Johnson in Belgium, Director Planning, Research and Statistics, Medical Lab Science Council, Abuja, Nigeria, Lead of Clinical Research Biostatistics at Satec Medical in Germany, Director Statistics at Moody Pharma Research Limited in Cambridge, UK, Consultant, UK Consulting Project, a lead statistician at DW, Jazz Pharmaceutical and GSK in United Kingdom. He's also a senior director in biostatistics in Melrose NV. When his former employer, after he had switched job, couldn't stop calling him, he took the initiative and founded Start Expert Consulting. As the founder and principal consultant of Start Expert Consulting Limited, he led a team focused on supporting biotech and pharmaceutical clients with regulatory biostatistics, statistical modeling, and digital transformation. His ongoing work integrates advanced analytics into clinical development and healthcare decision-making to drive efficiency, precision, and scientific integrity. Dr. Adeyemi has demonstrated substantial experience in regulatory processes, evidenced by successful engagement with global regulatory authorities like FDA, EMA, PMDA, NMPA, through his NDA. He will be the one to explain that one later. Notable in many of his achievements include leading the biostatistical support and successful submission of 2 supplementary new drug application SNDA for HIV-2 drug regimen, Dovato, alongside significant contribution to hepatitis C and colorectal cancer clinical study, including the pivotal SAFLOX trial. Recently, Dr. Adeyemi played a crucial role in obtaining regulatory approval for Bizengri in NRG1 fusion positive non-small cell lung cancer and pancreatic ductal adenocarcinoma. We will explain that one later. A milestone preceded by a breakthrough designation from US FDA for the drug in these challenging cancer types. Dr. Adeyemi is a sought-after biostatistician, which makes him to travel a lot. At some point, listen to this, at some point, as a frequent flyer of Lufthansa, he was rated as having accumulated half of cabin crew hours. You remember that with enthusiasm, he revealed that one to his wife, and his wife said, it shows that it represents your day out of the family. So he quickly cautioned him that you're already moving out of family. So in addition to his impressive academic and professional achievement, Dr. Adeyemi has held a numerous professional membership and has served as a referee for several prestigious journals, including Bulletin of the World Health Organization, Computer Method and Programs in Biomedicine, Decision Support System, Journal of Medical System, Journal of Medical Internet Research, PLOS1, and so on. I don't want to mention all. He was a junior fellow at the Newton Institute for Mathematical Science. Please clap for that. Cambridge University, United Kingdom. Science Fellows, Los Alamos in United States of America. Currently, he is a fellow of the Royal Statistical Society of UK, a member of the American Statistical Association, Pharmaceutical Statistician Institute, Institute of Directors, United Kingdom, and so on. Actively, he has participated in global scientific community dedicated to advancing statistical and healthcare research. Now, beyond professional academic achievement, Dr. Adeyemi is also an entrepreneur, having established ventures in agriculture. I don't want to mention Agbeloba, but I know that you established Agbeloba, hospitality, logistics, and cloud services. His passion for mentoring and education is reflected in his teaching roles, invited seminars in many universities, home and abroad, and has served as academic mentor at the University of Westminster and beyond. As a committed philanthropist, he founded the Adeyemi Olugbode Charity Foundation in honor of his father, supporting elderly citizens in his community. Personally, he enjoys time with his family. He's a jazz lover and he loves Nigeria cuisine. He is married and father of 5 children. Ladies and gentlemen, join me to welcome our guest speaker, whose life reflects a blend of scientific excellence, innovation, mentorship, leadership, brilliance, resilience, and social responsibility. Dr. Shola Adeyemi, thank you very much.
All right. That was huge. That was just huge. So we invite Dr. Shola Adeyemi for the lecture now. Thank you, sir.
Thank you very much, everybody. I couldn't recognize myself. That was definitely not me. I just want to stand on existing protocol. I'm not really used to speaking on podium, and this thing I'm wearing is just, packaging. This is not how I dress every day. I just want to thank the university for the invitation. I'm really, really humbled. I want to thank my father in the department, Professor A.P. Akinola. Thank you very much for everything you do. I have to thank him even before the dean, because he is the father of the department, at least the remaining father of the department. We had many fathers. Maybe they are now ancestors. And I want to thank Mommy. Thank you very much. I really appreciate it. Professor Ajadi, it's been from ages, but, you remain a good friend. And of course, our big professor also. I want to thank my brother. This man, we went through a lot together. But we thank God where it landed. The Dean, Faculty of Science, Professor Olufemi Adeyinka Adeshina. Kábíyèsí. And of course, to my Wura Ola. I know everybody refers to you as Antonia, but you are my jewel of inestimable value. And that's the mother of my 5 kids. And to the students, I thank you for the show of love. I thank you for really, attending. I hope I'm able to inspire you with my story. This is a journey that I started without knowing where it's going to land. And certain things happen that then push me on my path of destiny. Maybe that's why I'm not here today as a professor, like my brother said. But we thank God for where we all ended up. Thanks for coming. I hope you're able to gain one thing or the other, even if it's not the old jargons that I'm going to present, but maybe the story of my life. And I'm trying to carve that story through some kind of academic, enlightenment. And that's why the title of my talk is From Algorithms to Impact. And this is actually the story of my life, actually, in like 4 words. But it's a research journey through statistics, data science, artificial intelligence. Then I came across human-centered design, and looking at what some of the challenges we face in the world, we thought maybe we can actually leverage these algorithms to provide some solutions to the to major global health challenges. Thank you for listening. I hope at the end of the talk, we will open the floor for questions. If I cannot answer, I have my teachers here. They will help me. Okay. Thank you very much. So, everybody, we are on a path, and I've named that the highway of life. From being born in a village in Kwara State called Asia, I started enjoying mathematics, or let's say arithmetics at that point. And I think the enjoyment was based on the way that we were taught. We were taught with a mixture of English and Yoruba. When we're doing addition, they will say, oh, you have that much. When it's subtraction, ojegbese, you are owing somebody. So from the beginning, that's the way I wanted to see mathematics. And I then went to the University of Badon to study statistics. Of course, it made certain sense, but I still didn't get that Olowo Ojegbese vibe, right? So I tried to learn, unlearn, relearn, just to be able to teach statistics to people in layman language that they can relate with. And of course, I came to Ife, and it's a mathematical department. So everything people want to see or wanted to see is your alpha, beta, theta, blah, 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 So, but I went with the flow. And while I was Ife, I did my master's. And during that time, I was doing this research in mathematical statistics. And I was also enrolled in a PhD, but of course, that PhD was never defended. And then that changed the course of my life. So on the highway of life, I had to take an exit route, to do a PhD in London. And since then, it's been learn, unlearn, relearn. Learn, unlearn, relearn. Because things change very frequently, and you need to catch up with what is going on in the world. So we have so many healthcare challenges, and I just want to set the stage with this. There's a lot of disease burden. We have an aging population, and with aging comes all kinds of challenges. We also have emerging health threats. If you don't remember anything, you remember the COVID pandemic. So how do we try to leverage algorithms, statistics, mathematics to be able to forecast and predict, even we don't know what the emerging threat will be, but at what point in time can we expect another pandemic or another epidemic so that we can have healthcare preparedness? Then we have the inequity in healthcare. Of course, this is brought about by that, rich people, they get, better healthcare, poor people don't get, things like that. We also have health system capacity and patient flow, long waiting times, a lot of issues with capacity, and we also have inefficiencies in clinical trials. Clinical trials are very expensive, from identification of the chemical to actually putting the drug in the clinic can take minimum of 10 years, billions of dollars. How do we streamline that? How can we shorten the development? What kind of algorithms, what kind of leverage can we have in terms of statistical modeling, in terms of how to reduce that? And then we have data fragmentation. This is where you have disparate sources of data. And by having disparate sources of data, you are actually maximizing the usefulness of that data. You are not mining it enough to be able to actually generate useful information that can be used for service efficiency management as well as clinical decision making. We have shortage in healthcare. Of course, in Nigeria, we all know the Japa syndrome. And this is actually very rampant among healthcare workers. How can we leverage our algorithms to be able to support these shortages? We also have the ethical and responsive use of AI and data. Even when you have this data, how do we protect patient data? How do we make sure that the data is secured? And how do we make sure that AI is not biased to certain group of people? So these are some of the healthcare challenges. Having set the stone, then I'm going to start with my research journey. When I started at IFE, it was statistical distributions. And I'm not going to spend too much time. A statistical distribution is just a mathematical representation of a real-life phenomenon. And by having a mathematical representation, it gives you the opportunity to study the system generating that data. You know a lot about that data, and you can use that representation to actually predict future values, coming from that system. And that's the whole idea. We also study something we call order statistics, and that's just by ordering, those data, maybe from smallest to the largest or vice versa. And I'm sure you are used to some shapes like this. You collect the data, and they are like plotted in histogram. And then what we want are those lines that actually capture, the data that we've generated, that explains the data we generated. And as mathematicians, we are so, I don't want to say, we're so engrossed in looking at those, mathematical properties of those distributions, but most often we actually forget about how we can use it to actually, make informed decisions. And we also forget that sometimes we are the only one who understand it. If somebody wants to use that, then they need to consult you. So if it's not easy to use, then the research will just go unnoticed. So when I started in IFE, my supervisor introduced me to the Gombe distribution, and then we decided, okay, this distribution is not so flexible enough, let's generalize it. So by generalization, we mean that we make it more flexible to capture different shapes of data. And by capturing different shapes of data, we're able to use that, study the properties of that distribution and be able to apply it. And I applied this to predicting earthquake return periods. Unfortunately, we don't have earthquake in Nigeria, so I had to ask for data from a Tohoku region in Japan. And then, after this work, then we found that actually somebody had already overgeneralized. So they've generalized the extreme value distribution. But when we look at that generalization, and that's the issue with generalization, it's complicated. You make it more complicated. And then when you start to apply it, it becomes mathematically intractable. And then the whole algorithm will just go to one point and you say it's easy to show. It's not true. We will say it's easy to show, but it's not really true that it's easy to show. And then we wanted to work with this distribution, and with especially the order statistics, and we realized that it's really complicated to compute the order statistics. So we decided to develop certain recurrence relations to be able, if you know the easiest to compute moments of order statistics, with this recurrence relation, you can guess what the other moments will look like. So this helps us to be able to have a flexible way to model different real-life phenomena. And then we did all kinds of other works within these statistical distributions. And when the path of my destiny, came, and I was, I took that exit, and I went to the UK for my PhD. Then I stumbled on patient flow modeling, and this problem actually emanated from the University College of London Neonatal Care Unit. And we're trying to track when babies are born, are they in the neonatal intensive care unit, the highly dependency baby unit, or they are born into the special care unit. So it depends on the complexity. So if you are born preterm, you go there. If you are a bit better, you go there. If you are, and then you can be discharged to different destinations. And that was the problem that we had to solve to be able to model this and be able to explain and give suggestions to the researchers and the clinicians. So this is the data could look like this, but it could also be very complicated. But the idea is we want to be able to apply other statistics by grouping the attributes of the babies and be able to say something about the length of stay of babies within this unit. And we try to model those length of stay, and when we model, we want to show whether what we get from the mathematical representation actually matches the observed data. And here you will see that the expected minimum length of stay compared to the minimum length of stay from the data, it's really very, very close together. And by that, you'll say, okay, we have a very good representation of that, and we can begin to, say what's going to happen if another baby is born, what kind of unit are they going to be born into. And we actually, in this paper, we introduced the concept of random effect. Normally in a regression model, if you remove the z theta, that's just a regression model. And what you have here is the deterministic part. So you want to use patient attributes to make decision. Normally that one is just random error, but we introduce the unobserved variation can be captured with other things. And that theta is usually assumed to be normally distributed because of the mathematical convenience, but we're able to show that for this particular problem, I think it was an exponential distribution that models that better, and we were able to actually implement this in an Excel tool those days for clinicians to be able to use to predict when a baby is born, what kind of resources are they going to be needing, and what kind of which of those units they might likely be treated. And then we did a methodological case studies whereby we proposed 3 methods for actually modeling patient flow within the healthcare system. Of course, we were able to show that by applying any of these methods, you can enhance resource management. Of course, if you know that a baby is being born, you make preparations, especially within the unit that they will be born into. And this actually provided a lot of valuable insight and solved most of the challenges that UK neonatal care services were facing. And it also gives an evidence-based methodology. So this is something that my team was very proud of because that was when I started to see how things can actually impact outcome, especially in terms of healthcare. And then in the UK, they always have this value-based system whereby they pay based on value delivered. And they used to profile hospitals just with simple methods without looking at the case mix. Some hospitals will treat the very advanced cancer patient. Some will only treat, some other lesser aggressive diseases. And then it's difficult to actually, compare them. So we developed this methodology, and we had to use about 5 million records. At that point in time, we started with running our desktop, and we will run programs for weeks. We will still come back. Either the computer crashes, we weren't making an headway, and because I was in a faculty of information systems, we had computer science. So we approached our computer science colleagues. Egbami, this is not working again. Okay. So we worked with them, and maybe this is the first time that virtual computing actually started. I'm not sure. I don't work in that area. But we had some university, they pulled their computing resources and we could, write our codes in batches and submit it virtually to each of those, computer grids in different universities. So they were like slave computers, and we would have a master computer that gathered all the analysis from the batch code, and that was how we were able to actually, solve this issue. I think it took us about 3 years to actually get to publishing this paper because of this computational complexity. But this is what we need to do as, as statisticians or people who develop algorithms. If you want your results to be used and to have impact, then you need to find solutions to some complex situations. And then we did some other works around, patient flow modeling, which I don't want to spend a lot about it. We were invited to put a paper into a book on intelligent patient management. And I think this is where I came across data science. Data science at play some element of machine learning in terms of the modeling and the prediction. And then when after 2 years of my PhD research, I decided, I don't have salary in OAU anymore. I cannot stay. I told my supervisor I need to go and find money somewhere else. The guy said, after 2 years, you will not come back to defend because, I know you've, I said, look, I will be writing up. The 3rd year, I will be writing up. So I went and I got a job in the pharmaceutical industry. So that is also another journey that I took. And this is actually an interesting one. Normally in randomized clinical trials, you want to remove all elements of bias. You want to model certain things without knowing the outcome. And usually, when you are looking for cutoff in mathematics or in statistics, you always need to know the outcome to be able to define the cutoff that separates that outcome. But in clinical research, in clinical trials, you cannot do that. The regulators will say, no, you are biased already. If you know the outcome, it's like walking, to the answer. So we had to do something differently to convince the regulators. And then what we did was that we looked at only baseline characteristics of all, especially the tumor volume. This is a cancer trial, a colorectal cancer trial. And we want to identify specific population within the trial that has the maximum benefit from the drug. So we need to come up with a way to isolate those set of patients. So we, after running different scenarios, different statistical distributions, we came up with a Weibull mixture. And within the Weibull mixture, we had a cutoff of 12% tumor volume. This is not even knowing, the outcome. So we just look at the baseline tumor volume. And when we then use this to stratify this patient, we realize that those with more than 12% tumor volume actually get the best benefit from the medication compared to those with less than 12% tumor volume. And this is also an area where AI is playing a significant role in drug development, so that you can't kill every drug just because it's not working. How do you isolate a pool of patients that will benefit from that drug? This is a recent one whereby we actually did something totally unusual. It's really hard to have a drug approval when you don't have a randomized study. And what we did was to have an adaptive design. We did one study that includes dose escalation and dose expansion. So dose escalation is we want to know the maximum tolerated dose. And from that, we would now look at, it's an all-comer, every kind of tumor, lung cancer, pediatric cancer, liver cancer, everything in a bucket. And we have the design whereby we're looking at the data in a pooled version to understand which patient population would benefit from the drug. And at the end of the day, we realized that patients with the NRG1 fusion positive cancer are very, they benefit a lot. And currently, we've actually gotten approval for lung cancer and pediatric cancer. So this is something that we've leveraged data-driven decision-making for regulatory approval. And you can see the waterfall plot for clinicians who like to see this in conferences. That's the tumor shrinkage, and that is the exposure to drug. And you can see a lot of people actually, took the medication for a long time. And you can see this is all below 0, which means the tumor shrunk really, really well. And then, of course, we, at some point when COVID came, we look at COVID and the impact of meteorological parameters. We had other clinical trials where we had some nice design that shortened the time to market. And then one day I was just driving. I was driving to Belgium, and I thought, who is using all our research output? Maybe nobody. Okay, if it's nobody, can we get this in a user-friendly tool that people can use? You don't need to know statistics or you don't need to know mathematics, just easy to use tool. And then I started looking at artificial intelligence. I still can't say I'm an expert, but this is when you start to bring people on board. And innovation, my definition of innovation is when your algorithms or any research you're doing meet human-centered design. Human-centered design is when you do something for a purpose to be able to impact on the human race. So we look at what are the barriers. If you can understand the barriers to innovation, then we should be able to solve some of these barriers in developing tools that are user-friendly. And just some blurb about human-centered design. The thing is that instead of assuming what users need, it focuses on deeply understanding their experiences, challenges, and goals before creating anything. Before creating anything, is this a need or it's not? So, and that's the essence of human-centered design. And just to reflect again on some of the challenges that I started shortly, we want to start to solve some of these problems with our algorithms. But if we want anybody to use those algorithms to actually make impact with each of these problems, then it has to be easy to use for them because they may not be mathematicians. Our president of Nigeria is not a mathematician. He can't use complicated model if you don't put it in an easy to use tool. So when we dig deeper, we thought, okay, if we start from the disparate sources of data, can we bring every stakeholder into a single platform and with a focus on the patient? Because the reason why we provide healthcare is because, of the patient. There are the service managers. Service managers could be a hospital manager, could be the CMO, or could even be a policymaker. And then we also have the clinicians, medical doctor, health, nurse, mental health personnel, all other healthcare allies. We also have people who want to run clinical trials. One of the difficulty of clinical trials is also to find patients to enroll in clinical trials. So if we can bring all these people together in a single platform within the healthcare ecosystem, we can already start from somewhere. We can develop tools for each of these stakeholder in a single platform, and then we can share data as needed. If data is coming from the patient to the clinicians in a non, how do I put it? Because the clinician needs to know the patient they are treating, while the other stakeholders don't really need to know. They can look at aggregate data without digging deep into patient themselves. So we did a needs assessment, and we made it really broad. All kinds of professionals are included. We asked, what's your first reaction to an easy-to-use web? Nobody said it's very negative. That's already good. Everybody said it's either very positive, somewhat positive, or some are neutral. Maybe they don't even know what we meant by web-based tool. Then we said, is this something you need? As you can see, there was nobody who said definitely don't need. So, which means there's a need for that. Then we throw it a bit open. What exactly do you desire to have? And it ranges from administrative to clinical decision-making to planning, Then we said, okay, now we have a job to do. Of course, I've spoken about barriers, but of course, some of the barriers we also identified is infrastructural limitations, behavioral resistance, digital literacy, privacy security concerns, and of course, finance. Because even to develop the tool, you need finance. And having understood this barrier, what we did was to then, because like I always say, it takes a man to invent, but it takes a team to innovate. You can invent something, but if you want to innovate, you can't do it alone. And it also said that if you want to go fast, go alone. If you want to go far, go with people. So we started bringing a lot of collaborators together, different collaborators, different specialties, developers, all kinds of people, financial analysts. So we brought everybody together and we introduced the challenge, and that was how the development of the tool started. And this is actually the background technology that we ended up with. These are separate tools for all the different stakeholders, and the mobile application, which I projected here, is for the patient. And it has 4 profiles from I'm at risk. I'm at risk just means you want to uptake prevention or you want to do diagnostics, and through that profile, you can obtain that. And you can obtain it wherever you wanted in the secrecy of your home. And remember, these are some of the barriers to uptake of even immunization in some parts of the country. So this actually offers, a solution to that. And then we have I'm a patient, I'm a clinician, and I'm a body. I'm a body is just if you have a condition and you want your partner, your trusted friend to be involved in the management of the disease, they create an account and they help you monitor your journey. And of course, the clinician could be a medical doctor, a nurse, And then we have something we call situation room analytics. Because we collect a lot of data, we present this data in an aggregated, fancy dashboard. You don't need to understand the background, algorithms and the jargons. Just look at the aggregated data. And this data is almost in near real time. So which means that if anything is going on within the system, you know it in near real time and you can intervene immediately. So we have the background technology, and how have we used it? How have we used this background technology? So I'm just going to present some use cases that we've worked on. So the SmartX solutions was then customized for HIV, and we now call that Smart HIV solution. And it's a mobile application. It contains a mobile application and web-based tool. And this is how the background technology looked like in terms of customization. So the app is at the individual level. We have, all the other stakeholders, in the institutional level. The fact that you also include a social support system, that's at the community level or family level. And with this, we decided that we don't expect people to throw away their existing system. So we have some kind of API technology that helps us to seamlessly integrate with any existing system. So you can keep your system. If you want to leverage on our solution, we can integrate seamlessly with the existing solution. And when you go to the web tool, this is how it looks like. And from here, you can navigate to any of the ones that you want to use. And within the Smart HIV solution is the Smart HIV Manager for Service Management. And I just want to quickly say that when we developed this, we first put the algorithm into a peer-reviewed journal just to be able to showcase and peer review the development process. And in that paper, we actually put that this is one of its kind. I was telling my team, are you sure? The referee will ask us to expunge it. But they didn't ask us to expunge it, which means we validated that it's one of its kind. And it's one of its kind because it now has a user interface. You know, we had like 93 input parameters powering the simulation model. We have about 19 statistical distributions. You cannot mathematically track the different combinations, you know, so we had to resort to simulation modeling. And we have this beautiful interface. Even before you know how to use it, when you see this on the website, you'll be, you know, excited, you know, with the tool. But you will not know the complication behind it. So I'm just going to quickly do, so if we go to the Smart HIV Manager, you land on this page and you see patients moving around from diagnosis, and you can choose. This is actually for any country in the world. So you can plan HIV services anywhere in the world, Nigeria, the US, the UK. So you can imagine the enormous amount of money, data, parameters, you know, that has gone into this. And it's customizable. You can customize the input parameters every time we're comparing the current practice to the scenario you want to run. The beauty of it is that if you have a decision that you want to make, you can test the impact of that decision before you actually implement the decision. You will know whether your decision is cost effective, whether it's going to require so much money, it's going to require so much staff, so much doctor, you know, how many doctor hours, how many nurses hours, how many counseling hours, everything, you know, you can do with that. So, and it's really easy to use. You can see it's just clicking buttons, you know, customizing the input parameters to your specific scenario, and the model behind, depending on which country, will activate all the statistical distributions peculiar to that country, and the data, the background data peculiar to that country. And this is the first time you will find a simulation model that is web-based. It's really fast. It's really, really fast. And you can forecast over 3 years, 5 years, 10 years. And we have very beautiful dashboard, which always shows you current scenario, current practice versus the scenario you are trying to run. It's going to tell you where you have staff shortages, where you have enough staff, when you need to recruit more. It's really very easy to use. And yeah, it can be used by any country. Pharmaceutical sectors, they like this when they want to run cost effectiveness analysis, because this is not just looking at the impact of their drug on the patient alone. It's looking at the impact of the drug on the whole healthcare system. So they can actually go back to the healthcare payers and show a lot of evidence of the impact of their intervention on the whole healthcare system. I'm going to skip this so that we don't, you know, waste too much time. And then we've used this, after we've done the background paper, we've used this web-based tool to actually generate other scenarios just to, you know, showcase how it's used. The current paper that we're waiting to be published, we have a scenario, feasibility of ending HIV in Nigeria by 2030. And this paper, using that tool, told us how much it's going to cost, what needs to be done, what kind of preventive services, what type of treatment, what type of follow-up, what type of counseling, what type, you know, all kind of things. So, and this, I think, would need to, you know, be watered down a bit and put in a policy paper, because with this, we can actually implement ending HIV by 2030 in Nigeria. And then we have a CDC project where we leverage our mobile application. And in this project, funded by the CDC, is being rolled out in 3 states in Nigeria. Of course, the goal is to enhance quality of life, but we want to leverage, you know, digital tools. And we have all the necessary outcomes that we need to have impact on. We have the situation room analytics where we can, you know, have real-time monitoring. So this is how the app looks. As you can see, it maintains the 4 profiles. It's branded, you know, for the implementing partner, and we have the Nigerian medical record system integrated. So we fetch the viral load directly from that record, which means that patients don't need to actually go back to check their result. The result is delivered via their app, reducing out-of-pocket cost for patients. And also pharmacy pickup. They can just pick up their pharmacy in a community pharmacy without having to go to the facility. So this is how we are leveraging this tool to empower HIV patients. And we look at some primary outcomes. We already seen preliminary data showing that there's a jump in adherence. We have suppression already increasing. I believe we will match, we will match the 95 that is expected. We have 100% continuity in care. One of the reasons why there's a lot of issue with HIV is that people don't want to be seen around HIV facility. Otherwise, people who know them, immediately they see them. Even if you don't have HIV, if you walk across, to an HIV, people already stigmatize you. And with this mobile application, you engage with service without even showing yourself. So it's like a telehealth tool. And we measure certain satisfaction measures just to see how this tool has had impact. We can see that the average satisfaction is 94%. And one of the issues that I said in the challenges, privacy and confidentiality, has the highest index among the people using our tool. It's at 99%. And the lowest satisfaction is in the HIV care system. And you can see that there are some unobserved issues with that. But going forward with health system strengthening, continue to leverage this tool, we expect that to also improve. Having spoken about that, we also have a project funded by the Project Hope, and we're looking at empowering adolescent girls and young women leveraging this mobile application and the tool. And we customize, depending on the organization you are working with, you need to customize the mobile application to suit them. So we customize that, and the idea is that those women and adolescents can go through the self-assessment, and everything is done at the comfort of their home. If the assessment, the model agrees that, okay, they need to be enrolled, they are enrolled, they are immediately channeled to who needs to know within the system, and they can also monitor their progress, through the app. So, and that's one of the things that we don't have. We collect a lot of data from patients, but we don't present it back to them. So they really don't know what's going on with themselves unless they see a doctor and the doctor explains. So we present data back to them, and they can see where they are falling short, where they are doing well, and they can also, adjust accordingly. Then we have this other project in Ghana, Sierra Leone, and DRC, and this is because the LGBTQI population are highly stigmatized, which actually prevents them from seeking health care, and especially around HIV services, because there's a lot of high infection rate among this population. But if we can link them to preventive services and also reduce stigma and discrimination, then they will be able to uptake this. Maybe we can drive down the rate of infection among this population. And this work was funded by St. John AIDS Foundation, currently ongoing. And the same thing, only 2 profiles are needed here, so we call it BSmart Safe Hub. So it provides a safe hub for LGBTQI population to be able to uptake services. And of course, they can do an assessment, and they can find facilities close to them. They can order point of care diagnosis into a safe place where they can do their test, submit the test result through the app. If it's positive, a healthcare worker is linked to them to start the care process. If not, we provide education, how to stay away from risky behavior. And then a lot of people say, oh, is this really cost effective? So using our Smart HIV Manager, the web tool, we're able to show that actually by leveraging digital tools, these are the numbers for the worst case scenario. And we even factor in the fact that people who don't have mobile phone, if you buy mobile phone for them, you will still save cost by 3%, and you will reduce hospital visit by 14%. This is the worst case scenario. And you will reduce waiting time in the hospital by like 44 minutes. Human resources, you will reduce doctors' workload by 39% and nurses' workload by 42%. So it shows a lot of improvement and impact by leveraging this technology, because this is a telehealth tool. And then we also look at what is the ease of use. yeah, if we look at the demographics of users, they range from primary basic school to master's degree, from teenagers to even older adults, which means that either education or age does not impact on the good use of the digital technology. What we found is that as long as you know how to make use of a mobile phone, you are able to use our tool. So all the complicated algorithms, we are saved from that. Just use the mobile application, and sometimes we actually translate some of this mobile app to French. We can translate to Yoruba. We can, easy to use. Otunti Sunlo. Sorry, I think. Yeah. So we then say generally, what is the satisfaction among all our mobile applications user? It doesn't matter whether it's BSmart Safe Hub, whether it's the EQ's Speedy, whether it's the, so we collected this data, and you can see that, of course, we have good data measuring all the different elements, which are some of the challenges that I started from. And sorry, can you move the slide? So now we are working with a lot of partners to actually customize this, for other diseases. So we have the smart hospital solution. We are customizing this for a whole hospital. We are working with the NHS in the UK, but we are starting with cardiology. This is Smart Medip. This is Mental Health Digital Innovation Platform. We are working with all kinds of partners, and we always say that yours might be the next, because in my company, we don't hear that there is no solution. And it's mathematical to say there must be one solution. Optimum or not optimum. We must have a solution. So we don't believe in no solution. Throw us the challenge, especially after what we've gone through. Yeah, so I think what I just wanted to say is that we can start to tick, one by one. Of course, is the job is all done? No, it's not all done, but we've actually started. Data fragmentation, checked. Disease body emerging health threat, we kind of have a tool for it, but it's still not very well used. So we have our mobile application where you can uptake, and you can even report any diseases. So currently we're working on internet crawling, looking at things that are discussed on social media. This is sometimes where you can pick up when there are emerging health threats. Inequity, we are trying to solve that. So I believe we've checked some of this, but we are not there, but the work is not yet done. We keep pushing the frontiers. So we attempted that. And for me, key takeaways for scientists, policymakers, and entrepreneurs, especially in terms of healthcare, is that our algorithms, our data science, and AI must be human-centered to drive true impact. The future of public health is interoperable, personalized, and preventive. And academia must scale innovation through policy and productization. By that, I mean, if OAU develops something, it doesn't need to be to remain as an academic exercise. You can have a company spin out of IFE who is going to do all the commercialization and the marketing and implementation in an easy-to-use tool. And I think our faculty, we have all the resources, especially before all our fathers retire. Let's tap from their experience, because the Faculty of Science can actually be an academic node for innovation. So it's not me alone. I have a huge team, including my wife. She's both a team on the war front and when I get home also, And I also have a lot of partners. I partner with a lot of universities to make this possible. And of course, we also have clients and funders that we work with. But altogether, we bring forward a very potent army to start to solve some of these global healthcare challenges. Everywhere I go, people say, oh, your technology impressed. That is not the motive for developing it. We just want to make sure that the entire healthcare process is efficient, is effective. That's the only thing. So I must tell you, I enjoy that it impresses also. So this is my journey, and I believe as you guys also start in this university, I'm sure you're going to do greater things for humanity. Thank you very much.
Yes, thank you, Dr. Shola Adeyemi. That was very impacting, very, very impactful, very interesting. And I'm very sure we all took. Yes, it is now time for question and answer. Questions from the students, colleagues. This is what we're going to do. If you have questions, let's have your hands up so that we can collate them, and you will answer them together. Okay, just please, can you write it down, please? Note your question, then I will collect them. Look it up. Online. Okay. Now, those who are online also, please, you can send your question so that they will be taken together. And ask somebody to collate the question on. Please, let's raise your hand so that it will help to collect the question. Please. Those online should please send their questions to. Can we get through with them? Can they ask questions? Okay. All right. If you're online and you want to ask questions, you can indicate so that we'll allow you to ask your questions. But then for those of us that are here, kindly just raise your hand. And is there anybody online now that want to ask questions? Dare or Watimi, okay? Can he ask his question now? Are we through with him? All right. Question from Dare. All right.
Hello, good morning, everyone, or good afternoon. Dr. Shola, thank you very much for that presentation. It's really, really insightful. I've got two questions. So the first one is, what policy constraints currently exist in Africa or Nigeria specifically that needs to be addressed so that we can accelerate these patient monitoring systems? And then the second one is, what sort of incentives do we need to get or put in place to support academia and industry collaboration locally, especially from OAU? Thanks. Very good presentation.
Thank you. Any other person? All right. Maybe the.
Thank you very much. There's a lot of constraints in Nigeria. It's not just policy. Of course, this could be solved by policy. I think the constraint that we started with when I was making presentation, there's also some kind of behavioral issues. People don't like change. Even before they understand that they're going to benefit from something, because they're in their comfort zone, it's really difficult to get through to be able to, leverage this. There's also the issue that people thought that AI will replace humans and their jobs, and they don't want to be, left jobless. So even before we start to talk about policy constraint, there's
Mute
this
on.
issue also that we need
Mute
to.
off.
The government is not putting any, any policies in place, or not so viable actually in terms of what we've been able to do. We had a lot of advocacy within the Nigerian government, but the issue is that there are so many things going on, and that's why we had to go through international organizations. So they kind of listen more to international organizations than for a Nigerian coming to say, let's help. So most of the projects we're involved in are via the international organization route. I hope I was able to answer that. Yeah. So the second one is incentives to support academic and industry partnership. So I don't like to blame government all the time. I think we as academic also need to do things differently. The best way to have academic and industry partnership is for industry to recognize that you have something they can invest in. So if you don't show the impact of your research or how it can be used, and you can pitch it to industry, they may likely not be interested. And this is the issue. So we need to do something in our own way too. Of course, people can do a lot of theoretical research, but there may be people who also are interested in applied research, and through using this theoretical thing and applying it, could actually, be turned into something that industry might be interested in. One of the things that I will be discussing with the dean is these emerging health threats. The WHO, they have a model. They have other center of excellence who have models. But these models, when I look at them, but people stay away from complex things. But even with the simple things they are doing, they get a lot of money. We have a lot of cognate faculties that we can pull in, apply for EU funding. Let's be bold, and we can actually do better modeling. We can turn it into easy-to-use tools that we can pitch to policymakers. If the policymakers are not interested, we go to pharmaceutical companies. We showcase what we are trying to do. They have money. They will fund us. At the University of Cambridge, the revenue of Cambridge is, I don't believe some private companies in multinational have the revenue of Cambridge, but they have a lot of spin-offs from University of Cambridge. They have a whole Cambridge Research Park, which is filled with spin-offs from the university. By now, OAU should have a research park filled with spin-offs. Even if we don't have external companies coming, we should have our spin-offs there. People will invest. Thank you. So this question is, at what point in your research journey did statistics begin to make sense? I mean, when did you start applying the theories you learned in the class to solve real human problems? Thank you. So when I gained admission into UI, I was one of those people who wanted petroleum engineering, and I just found my way in statistics. In fact, I had options, math or statistics. I thought, okay, what to need statistics? Let's go and see what they are doing there. So that was how I stumbled on statistics. And then those days, bless our forefathers, they were bringing people to come and give talks like this. And one of the people was Professor Oshuntogun, and I don't know whether she's still around. She was working with the Federal Office of Statistics, and it was actually surveys that she came to talk about. And then there was also Professor Bamigboye from Public Health in UI, who also came to talk about medical statistics. So I was thinking, there's pepper in this thing. So I was thinking, okay, I can work in WHO, I can work this, I can work. So that was how I started looking at it. But when it was time to do my BSc project, I was thrown to a supervisor who didn't even listen to my interest, just said, you are going to work on that. So I worked on time series, but then I had to apply it to University of Ibadan guest house patronage data. And that was how I started to see, how these our algorithms can be used. But the big lesson was when I was actually here at OAU during my master's, and I had the opportunity to go to the Los Alamos National Laboratory in the US to work as a staff research scientist. And I was thrown in the middle of civil engineers, electronic engineers, electrical engineers. What were we trying to do? We were trying to model damages in civil engineering structures. And I was seated there, and I was seeing alpha, beta. They were telling me that alpha is one node, that beta is the stress level, that let me be serious with this thing, though. And that was how, that was how everything changed. And I remember when I came to Nigeria, I brought R, and a lot of people learned R through me, and I use R in my teaching. So that's how I stumbled on, solving real life problems. So this is a very good question. Doesn't such collection of data put patients at risk of data exposure? Yes, it does, but the issue is that it depends on how the tool is implemented. I think I just showed a data there where actually users rated our privacy and confidentiality 99%. That's really high, right? And what we do with implementation is that we encrypt your data, either at rest or in transit. So we make sure that even if the patient's phone is stolen, they cannot have access to, to that data. The data is hosted on the cloud with double encryption technology. Kindly justify why 19 statistical distributions were used. That's a tough one. Okay, so in that model, we need to model different kind of data. Is that coming from you, Sandra? Okay. That's a complicated model, right? And as you can see, it captures a lot of things within the care pathway for HIV. And different countries have their own different care pathways. So in terms of modeling waiting time, service time, all these kind of things, one model does not fit all. We ended up, in fact, we streamlined to, 19 statistical distributions to do that. Do you know how many countries we have in the world? You can't have one distribution representing the behavior of everybody. Even within the family, you can't do that. Can AI be based to a certain set of people, and how and why? This is documented, though. This is really, there's bias in artificial intelligence. There's a study in the US whereby Black people are more likely to be flagged as, criminals than white people. We also have the issue of an AI in recruitment, whereby minority women are less likely to have jobs based on that algorithm than the other people. So I can give you a lot of examples documented in journals. Firstly, I would like to commend the effort of the team with coming up with this groundbreaking solution, in as much as this solution can be supported and effective in data-driven societies like the UK. How much can it be trusted in societies like Nigeria, where data collection isn't a norm? That question is multi-dimensional. So most of the projects we're currently working on is actually in Africa. I showed you one in Nigeria. So which means it's not a barrier. Nigeria is not a barrier to roll out this kind of implementation. And this is where it relates back to the other question about the many statistical distributions. So within Nigeria, even if you don't have robust data, there are assumptions that can be made and put some kind of statistical distributions. If you've heard about adaptive statistics, Bayesian statistics, you can start with a vague prior knowledge or the scenario, and as you generate data, that vague prior becomes more precise to the country. So like I mentioned before, in my team, we don't see a challenge like it doesn't have a solution. There's always a solution. So we can refine things. We can start from a vague data. We can model that vague data into a statistical distribution, and we can refine it, fine-tune it over time until we get what we wanted. Thank you. What programming language can be used to deduce statistical data? That's the first question. To deduce statistical data. To analyze or to, okay, I'll get to that. And then the second one is, how can we, for someone that understand Python, how can we incubate into statistics, and as a biochemist and molecular biologist, how can we integrate it to our career for a holistic profession? That's really interesting. So the first question, there are many programming tools, and of course, this same person mentioned Python. So, I mean, some of the things we did is based on Python. The web-based simulation model was actually coded from first principle in Java. Not me, I didn't do it. I have very smart people with Java and Python who would do. So you already have Python. Python can be used for statistical analysis. And in order to be able to move into statistics, nowadays you guys have a lot of resources to learn. You have people around that you can, if you put a prompt on ChatGPT to design a course for you, for a basic learner, you get a course that you can even put timing. I want to learn statistics in 2 weeks. It will structure the course for you. So you have a lot of resources. And if you want to integrate statistics into your career, starts from when you want to choose your project. When you want to choose your project, choose a problem that you will need to analyze data, model data. You don't need to know it. Seek people who have the knowledge, work with them. You learn through that process. And yeah, I know a lot of things about medicine now because I work a lot with clinicians. It doesn't make me a clinician, right? So yeah, just continue to learn. And you have the resources at your disposal. As an undergraduate, was there any point in your journey that you felt that you were wasting your time? I mean, studying a course, how did you tackle it? I'm going to keep this question for myself. To be honest with you, I think I just mentioned that I stumbled on statistics. And the first put off for me was the lecturers that came in with, you see medical doctors, if you are studying medicine, it's like, lab coats. If they ask you what department are you, you are not even so sure whether you should say it or not. But I think when you are studying a course, nowadays, the course you are studying does not define your career, does not define your end goal. I started as a statistician, and now I don't even call myself a statistician again. I'm a digital transformation expert. digital transformation expert. Thank you for the detailed presentation. Please, can you give a brief explanation on the career of a PhD holder in the field of mathematics, statistics, outside academics in Nigeria and not outside the country? If I start now, really, maybe I need to come back. In fact, I'm doing I was invited to write a book on the career progression of a statistician in the pharmaceutical industry. So, but anyways, I think PhD holders still have a lot to offer, you know, as long as you can show what you can do. I've seen people who finish PhD in mathematics and they end up being programmers or they end up being AI experts, AI engineers. So everything is in your hand. Economists, people have become anything actually. That's the beauty of mathematics. You can just be who you want to be. I've seen people who finished mathematics and went to medicine. So, and they became professor of medicine. In fact, it's just a basic degree which gets your brain charged. It gets your brain charged, which means any little thing you can, you know. As a biochemist, can you merge statistics with the beauty and medical industry? Of course. I work a lot with actually biochemists. I have a nephew amongst you who was explaining to me the project he was doing. I was talking about some protein inhibition. And the way I was asking questions, it was like, did you read biochemistry? So most of this chemical or even biological process can be modeled. So guys, you shouldn't be asking these questions now. You are internet age now. You should know that you are relevant. It doesn't matter what you're doing in basic science. You are relevant. You can be relevant anywhere. So just keep doing it. Put in the best. Anything that is worth doing at all is worth doing well. You can't come out with a biochemistry third class and complain that you can't get into industry. Of course, you won't get into industry. There's a lot of biochemists working in pharmaceutical sectors because most of the drugs that we take start as chemical compound. You work with rat models, you monkey models, try to test those chemical compounds, whether they can be effective on one disease or the other. Everybody can be relevant. I always tell my mentees at the University of Westminster, where I'm a mentor, I always tell them, if your idea is to go into the pharmaceutical industry, it's a big place for anybody to have a place in. Thank you. Good day, sir. Thank you so much for the lecture. I really learned a whole lot. So my question is that I'm interested in research and I don't really know how to go about it. So you can share some roadmap to be a researcher, and also is it possible to share your presentation notes, sir? Of course, I can share my presentation notes. If you listen to my presentation, to become a researcher, you need to be grounded in something. So because before you can research something, you need to be grounded in something. So you need to study and you need to do research that, don't do lazy stuff. Be bold. I mean, those days, our fathers in the department, you solve the solution to you solve the problem to a particular part, they tell you, that's okay for a PhD, or for a master's. Even I asked my supervisor one day, I said, we've not finished this. He said somebody else will take over from there, right? So just do whatever you want to do it properly, and you can go into research, you can go into industry research, you can go into academic research. You just need to know what you want to research in and know it deeply. I have how many questions here? 6. How was your journey in building algorithm? I mean, your difficulties. The This is what I tell MBA students that I teach innovation and entrepreneurship. I say when we talk, we say the sweet stories. But there's a lot of sacrifice behind all this. Actually, the dean started by saying we will teach 9 hours of tutorials. We are master students, but we still need to do our research, study. You need to burn night candles sometimes. You really need to work very hard, and that is it. Even despite those distractions, we still set time, to get things done and do it really properly with excellence. In a nation like Nigeria, where data is not available or in whatever, what can be done. I already spoke about this. Even the fact that the data is not precise, it's a research. How can we leverage that? What can we leverage to use that data? That data that is not so accurate, what can we do? What kind of algorithms can we do to make sure that that data is usable? That's a research itself. How do you blah blah enormous data coming into the app? So I think that's leverage enormous data coming into the app. So that's why we had to make this a web-based tool, especially the web-based tool and we maintain it in the cloud. So it's a cloud server. And the good thing with cloud servers is that they are very scalable. As the amount of data increases, you can scale the memory, and that's why the simulation model runs really fast, because we take the highest speed on the cloud. So there's several ways to make sure that you can enhance the data and also protect it. I also mentioned that the data is highly protected. It's double encryption technology at rest and in transit. Can this data gotten through the app be available for researchers? Yes, that's what I started with. Those data can be shared with who needs to know. Of course, the medical personnel needs to be able to identify the patient to be able to provide optimal care. However, researchers don't need to know what data belongs to which patient. So that's why the dashboard is there to present aggregate data, and it can also be sliced and diced, based on different metrics. Does the app help patients to locate nearby health centers? Correct. You can locate nearby health center. If you don't want the one closest to you, you choose the one that is further away from you. You can order, if they have a point of care diagnostics, you can order to a safe place. If you don't want people to know that you want to do HIV test, you order to somewhere, you go there, do it, report the result on the app. The clinician picks it up. You are, linked to care immediately. Is the app available for everyone or for some specific organization? We have the background technology app on iOS and Google Play Store. Most of the functionalities are free, but if you want to enjoy the maximum benefit of it, because you need to be linked to a healthcare provider, and we have an in-app chat facility which we developed from scratch. For this technology, we did not rely on any third-party software. And the reason is that we want to control the cost. If you rely on third-party software, if they increase the cost, you need to pass that cost to the customer. But we want to use this technology to benefit our African people, and we want to minimize the cost. So this is a technology that was built from first principle. So anybody can download the app and use it, the basic functionalities. You can use most of it. It's just that you need to be connected to a healthcare provider, a clinician, to enjoy the full benefit. This is an online question. Thank you for the impactful presentation. How can you use your industry and practical experiences to develop both the lectures and students intellectually and commercially of the newly created Department of Statistics? This is some of the meetings I will have when after this talk. Like I mentioned, there are different routes that we can do this. I've also mentioned during answering questions that currently I teach every semester MBA student at the University of Westminster Entrepreneurship and Innovations. I have at the University of Westminster every semester I get assigned mentees, mostly graduating students or penultimate year, and they just tell me, this is what I want to do when I leave the university, and then I mentor them through that, including even teaching them how to write CV, impactful CV, how to write cover letters, and also suggesting where they could apply to. So we can replicate most of these things.
Please, let's appreciate Dr. Shara again. Yesterday, when we were together with my wife too, and then we had the retired Professor Biladi and his wife that came, to the gathering. And then we talked about the general administration of the university. And then Mrs. Antonia Adeyemi is an administrator in the university. And I said, maybe she will share a bit of her experience with us so that we can tap one or two things. So for 5 minutes, maybe she can, because we have to, every opportunity that we have, that we bring people over there here, we want to see how they do things and things are working so that we learn and drink from their cup of experience. So please permit me just for 5-10 minutes for Mrs. Adeyemi. I hope you are prepared for a very short one. Thank you, ma'am.
Great Ife. Great Ife. Great Ife. Good afternoon, everyone. My name is Antonia Adeyemi, and I'm currently working at the University of Cambridge. You have all heard about the university, but you have not heard about what I do there. So I work with academics, and I work with administrative staff. And one of the programs that I run for academics is the Senior Leadership Program for aspiring HODs. I also run the Head of Institution, that's the equivalent of Head of Faculty circles, which are mentoring circles that happen once a quarter. So yesterday, and in the past few days, we had discussions with distinguished professors from the University of Ife, and we discussed the importance of leadership. I personally feel that leadership is not a position, is not a title. Everyone can be a leader, and it's about walking in your leadership shadow. If you haven't heard of the leadership shadow model, I encourage you to look up the Goldman Sachs leadership shadow model. Apologies, I haven't prepared presentations, but I was caught on a short notice. A couple of points where I believe that leadership is really important, especially leadership in academics, and so important in Africa as well. All the great professors I have heard from Ife have one thing in common. They were all great role models. They all led with impact. Everyone remembers Professor Afuape from the Department of Mathematics. Everyone talks about Professor Fakbogu. Apologies if I don't pronounce the name correctly. Professor Obilade, that we met yesterday. So why leadership? I think it's important that head of departments and head of institutions join collectively and think about the future of the institution, the future of their departments, the future of their faculties. how they can shape the culture so that it can meet the external factors. The technology, even today coming here, I noticed that the projectors might need to be upgraded. So I'm offering donation of 2 projectors to the faculty. Studies and research have shown that HODs, head of faculties, deans, are unprepared for leadership roles because the focus is on research. They're great researchers. They're great in what they do in academics excellence, but they're not ready to lead, or not all of them are ready to lead. They don't have knowledge and expertise in budget management, in people management, in inclusion and leadership, as well as they don't always have the support that is required. So how can we make sure that we empower and encourage our leaders to lead and be efficient as role models? A couple of points: coaching, mentoring are very efficient, especially peer mentoring. Learning from guest lecturers, but also using alumni networks, such powerful tools to connect to all the alumni from this great university across the world. You have alumni everywhere in the world. That's the beauty of this university. If you go to Europe, if you go to Canada, if you go to America, you have one person in a high leadership role, either at university or public sector or corporate, who is an alumni of this great university. Peer networks and the importance of actually head of departments from different departments talking to one another, discuss and solve challenges is so important. But also building critical skills such as inclusive leadership, inclusion, diversity, belonging, and also creating a powerful impact. So I believe that when we develop HODs as leaders, we don't only grow the departments, but we also grow the future of higher education in this great university. So hopefully there will be more opportunities for collaboration and opportunities for me to tap into the potential and share my expertise on leadership and development. Thank you so much.
Thank you. All right, thank you. Yes, thank you so much, Mrs. Antonia. She said, I think that is okay. Thank you so much. She said she's going to donate 2 projectors to the faculty. I think we should appreciate her for that also. Thank you so much. Yes, we know we are working behind time now. She actually did that, and we appreciate her for that. We have 2 things to just quickly go through before we start going. I will call on Professor, our prof, to come and give a goodwill, just a goodwill message. Professor Akiola. Then after that, we have the chairman of the committee to give us a vote of thanks so that we all go back to our various activities. Professor Akiola, sir.
So for me and you, I'll be back for you. I don't know what the future brings, but I want you to.
Yes, I really appreciate the organizer of this special and scintillating lecture by our guest lecturer, Dr. Adeyemi. Dr. Adeyemi, we are very proud of you. You are a worthy alumnus of this university, faculty, and the department. And your office in the department is still there. Yes, we thank you. Your lecture has been quite expository, inspiring, and motivating. And I believe that good number of us would have a lot to benefit. Of course, we appreciate that you are there doing us proud. What is mitigating against activities in Nigeria is lack of industrial production. Where there is industrial production, of course, of necessity, there will be interaction, strong interaction, fruitful interaction between the academia and the industry. Of course, the grace that we have here, and we must thank profoundly our founding fathers, particularly in Ife, that is University of Ife, Obafemi Awolowo University, that they endowed us with strong background. There's a Russian adage that says nothing is as practical as a sound theory. Ife has been founded on professing sound theory. And that has been our, grace, the moving grace for us, that even after when we go out, we will still be able to fit in. But, like I said, what we have lacking is lack of industrial production. And that is why nationally, we hope our rulers, we know that it is important for any serious nation, particularly this developing nation, to pursue industrial economy. That is manufacturing and production economy. It is in that you'll be able to create jobs, you will be able to reduce security challenges. And in the universities and research institutions, their hard work will plume, and the country as a whole will benefit tremendously for that. Now, I won't say that. I had this short whatever for our special lecturer. Yes. Talking of model and generalization of model, for the benefit of laymen like us and the young budding one here, which metrics, from your extensive industrial experience and knowledge you've accumulated over the period, so which metrics or parameters will you think or will you advise that we'll be looking for so as not to pursue what we call wild goose chase? That is, whatever model or generalization that we are coming up with will be tractable and still make sense. So on this note, I thank you profoundly once again. Thank you.
And when the stars come out tonight, I'll think about you, my love, my love. And in the dark, I see your lovely eyes.
Daddy, actually, nowadays, we really don't care about how many parameters models have or whether they are tractable or not intractable because we have the computational powers to deal with them. So that was something of the past, actually, before the advent of supercomputers. And I just mentioned that within the simulation model that I showed, there are 19 statistical distributions, and there are permutations and interactions between these distributions. So you can only imagine how complicated it is. We were not actually looking for tractable solution. That's why we resorted to simulation. And with that, we don't need to bother about how complex the solution is. I think when we started, we were limited by computing power. I remember if we get somebody to send us a paper from abroad and we had to download it, we would start downloading, go to Old Booker to go and eat, and God save you, NEPA doesn't go away because by the time you come back, NEPA goes, the thing has not finished downloading, you restart again. And most often we would spend the night in the computer room. We had, I think, 2 computers then. We take turn, even as graduate students. And I remember when I was doing my master's thesis, at a point I proved a convolution of some of independent generalized Gombe distribution to a point, and I went to Professor Joe. I said, I don't know how to go further. Prof said, okay, you need to do T approximation. With this T approximation, I was using calculator. I was using calculator to do that. But that is now a thing of the past, actually. We don't look at, that's why AI, if you look at the amount of data that powers AI, the kind of machine learning models that are built in, the kind of statistical distribution, mathematical models they are powerful. That's why when you use ChatGPT, it's like you are talking to a human being. So I think we are in a good, in a good position to actually enjoy our mathematics now. This is the best time to actually bring out the beauty of our mathematics. All the complex algorithms, we can easily just, use them now. Thank you.
Would you be my Juliet? Tell me you're Romeo. Oh, my love. Oh.
Yes, please, before the vote of thanks, we'll have the presentation of award by the chairperson, Professor Drosini.
The Dean, Burola, please. The Dean, distinguished Professor Akinola, our distinguished professors and our students. It is my great pleasure to present this token of appreciation to Dr. Adeyemi. You all agree with that we have picked one thing or the other from him. On behalf of the Faculty of Science of Obafemi Awolowo University, we're very delighted to have you, and we appreciate the guest lecture. Thank you very much.
Into the story notes.
Great. Great.
That's your pieces on and heavenly. Baby, you are my song.
All right. The vote of thanks will be given by the chairperson of the program, the committee chairman, Professor Ajadi.
Thank you, Professor Okonji. Let me start by thanking God Almighty for making it possible for us to have this occasion realized. We cannot thank him enough because it is one thing to plan, it's another thing for it to be executed. So we want to thank him for this special grace. I want to thank, let me start from the students. because without you, there's nothing we can achieve. So great Ife, articulate Ife, ever conscious Ife. God bless you for honoring us with your esteemed presence. We really appreciate you. And I believe that you have gained one thing or the other from the presentation. And I want to assure you that by the grace of God, you are going to be greater than the person who came to present to us today. Let me also seize this opportunity to appreciate our lecturers who have also deemed it fit to honor us with their esteemed presence. The HODs have been wonderful, starting from the HOD of biochemistry to botany to mathematics, statistics, zoology, just name it. We appreciate you. And to all those who are seated, Professor Mitogun, I can see him seated here. We thank you for honoring us with your presence. All the professors in the department, the faculties, the university, we appreciate you. Thank you so very much. And let me come to the high table. Our elder in the department, Professor A.P. Akinola. If you don't know the meaning of A.P., Ade Peter Akinola. So, he said it's African petroleum, but I don't agree. Let me also appreciate our chairperson for the day. I will tell you one thing. If there's anybody who should be well appreciated, I think she's one of them. It was just yesterday. It was just yesterday, maybe afternoon, that she was informed that she's going to play this role. In fact, when the dean said she should be the one to do it, I said, I can't tell her because just 2 days ago I was with her. I never told her that she would be doing this. So you have to tell her as the dean. She said, no, don't worry. Just tell her that the dean said. And that's exactly what I did. And she took it honorably. So we thank you, man, for not looking at us as these small boys, you know, just commanding me to come and do this task. We thank you for honoring us with your esteemed presence. We know she's a very busy person, very, very busy, but she has honored us and she has honored the guest speaker, the guest lecturer rather. So we thank you, man. God bless you, man. And to our indefatigable dean, you know, the MC said a while ago that if you are talking of a dean, there are deans and there are deans. This is a dean that has made impact. This is from the lecture, algorithm to impact. Dean impact. So, and there are still more for you to see. There are still more impact to be made. You are seeing the biological sciences becoming renewed. You are seeing the White House becoming renewed. More and more things will get renewed. And every one of you will be renewed. And to my committee members, I thank you so much. I didn't do this all alone. They supported me left, right, and center to make it work. So thank you so very much. Now, let me now go to I don't want to mention the ghost lecture because it's going to be the last. Let me appreciate our Olori. I call her Olori. Olori Wuraola Antonia Adeyemi. There is no doubting the fact that she's a wonderful lady. When it was getting to time that, I just told Dr. Adeyemi, don't bother come to Nigeria if Antonia is not coming with you. And he didn't say anything. He just used one of the emojis. So when on Friday they told me Antonia is around, I said, God save you. If not, this thing will not hold. Yes, she is a very wonderful lady. Yes. And I'm proud to say this because I've had the privilege, opportunity of visiting the family in Belgium. And sincerely, you'll be at home. In fact, if you think you are more Yoruba than her, you are deceiving yourself. You are not more Yoruba. If you say, how many of you can pound yam here? How many of you can do Amalaya? So if you think you are more Yoruba, you are not. I can assure you of that. She is more Yoruba than, well, maybe some of you. And not only that, apart from being a good mother to her children, She's a good wife to the husband. Very, very submissive. So that is a good, I'm telling you this because of the ladies seated here, that this is what I've experienced. And you should know that she's a good role model, somebody you can learn from. Thank you so very much. And to our guest lecturer, Dr. Shola Adeyemi. Dr. Adeyemi is one of the, how do I call it? A colleague, is a friend, is an aburo, is just mentioned. And is one guy that he has this positive disposition to human affairs. And you can lean on him, you can rely on him for anything that will make you to progress in life. He's such a wonderful human being. And I'm not surprised that a wonderful man is meeting a wonderful woman. So, Dr. Adeyemi, we really appreciate you for this very, very incisive and very, very detailed lecture. I believe that our students have been, motivated, and I think that many of them are going to take after you, even to exceed you by the grace of God. So I want to thank you for taking your time to come and, honor us with your presence. And let me not forget to also say this, because you see, in life, we don't say because they are no more, we should not recognize them. There are some ancestors that brought us together, that, did some of the things that some of you are saying physically today. Somebody has already mentioned, even Olori said, Professor Afakwe, Professor Fagbon. Indeed, Mrs. Fagbon is with us physically here. Mrs. Fagbon, it's nice having you around. And his daughter is also with us. So we talk of Professor Emojo, who was the supervisor. We talk of the likes of Professor Alegbe Shola, Akinlere. These are people, with the support of Professor Epi Akola, these are people who brought us together. And that is why you can still see that, that bond still there together. So it's a lot that wherever we find ourselves, we should lead in a way as to be able to make sure that the future, becomes better than the present. So I want to thank you so very much for your... So, lest I forget, let me recognize another Olori here. That is when a man achieves greater height in what he does, when a man achieves greater height in what he does, he's not doing it alone. When I told you the dean is performing wonders, you think he's doing it alone? If we remove one thing from it now, it will just fall. And his better half is here, and that is Olori Bumi. Olori Bumi Adeshina. So she's here. You can see she's so nice having you here. And all those who have come, whom I cannot recognize for one thing or the other, I thank you so very much. And let me also thank our MC, a professor of biochemistry, who decided on his own volition to be the MC of today. It's a grace. So I want to thank Professor Raphael Okonji. Thank you and God bless you.
Yeah, thank you so much, Prof. Yeah, quickly, we're going to have a group photograph before we part. Yes, sorry that I will have introduced myself too, but I don't want to be selfish about it. But I'm glad Prof did. If not, I'll just get to my room and be thinking, she don't know about to introduce Rami. Yeah. But yes. All right, so quick one, a group photograph for the people on the high table. So I think maybe we'll just get to the front here. Yes. The photographer.
Go only for the mess. Yeah.
Okay, yes.
And you're one of a kind. So many people wish you were the third in their lives. I'll be crazy not to take you in line. Yeah. But just before you decide, I need to tell you I'm that. Is there something that guy I never missed a ride? All I couldn't might be your time. I'm that. Is there something that guy I feel you. You seem much deeper than my issues. Got me believing that I can trust again. I guess that's the first step to find true love again. Yeah. And you're one of a kind.
All right.
The girl in their lives. I'll be crazy not to be queuing in line. But just before you decide, I need to tell you on that. Is there something that I never missed our right? All I could lay might be your type. On that, is there something better, guy? But I need your love. I need your love. Deep down, I know that girl, I need your love. I need your love. Deep down. Are you not scared I might
Thank you.
be worth the fight? All the times I didn't believe. But girl, you